Wellness Wednesday on Fox 54 News, sponsored by WeGenesis.
In case you haven't heard, it's Colon Cancer Awareness Month, and according to the American Cancer Society, excluding skin cancers, colorectal cancer is the third most common cancer diagnosed in both men and women in the U.S. This Wellness Wednesday, our Jasmine Bird introduces us to a Crestwood physician who shares the importance of regular screenings.
This is March, and more importantly, it's Colon Cancer Awareness Month. That's the reason GI practices across the country want to celebrate March to improve the awareness of colon cancer.
Colon cancer is the second leading cause of death among men and women.
It is the second cancer after breast cancer that is totally preventable and treatable. Even breast cancer isn't preventable, but colon cancer arises from colon polyps. You remove the polyps, you prevent cancer.
Dr. Smith-Tusha with Crestwood Medical Center says although some may not like to hear it,
The best and the golden test to find colon cancer is colonoscopies. Okay? It's a conversation that sometimes people feel embarrassed, but colonoscopy is the most important thing, most important risk that you can modify for yourself, especially if you are age 45 and above.
your first screening colonoscopy, if you have no risk factors, should begin at age 45. And then, if it is normal, you're good for 10 years.
However, if you have a family history of colon cancer or colon polyps, you need to start earlier. You need to start at age 40 or 10 years before the youngest person in your family that had colon cancer.
And another thing to be mindful of, dietary choices.
You can cut down, you can eat a high fiber diet, cut the amount of red meat. Again, as I said, these are only modifiable diet factors. Even though you have to go through, I would guess, a day of discomfort with going through the lovely colon preparation, colonoscopy is still the best way.
In Huntsville, Jasmine Bird, Fox 54 News.